Hey, welcome. Thank you for coming today. I'm Howard Hall with ProxsysRx. I have with me Lauren and Heather, and welcome to the Specialty Pharmacy Roundtable. All right, so guys, why would my hospital want their own specialty pharmacy?
You know, first thing that comes to my mind is keeping the patient care within the hospital system. So when you have a specialty pharmacy on site, you can ensure that those patients are cared for appropriately. You can monitor the patients. You can make sure they actually receive the medications prescribed. And then, you know, on everybody's horizon now, especially if you're a 340B covered entity, is the manufacturer restrictions. So, you know, when you have a pharmacy on site, you do get access to the 340B pricing despite their restrictions.
So tell me a little bit about, you know, what does that mean for a patient to go to a pharmacy on the place where they had care? I mean, is it a big deal for patient satisfaction? Is it nice to have or a have to have? What is it?
So one of the things I think about is if you're getting your care at your hospital, you're going to a clinic near your hospital, why not also go get your specialty medications right there on the hospital's campus? One of the big things with it being right there on the hospital's campus is your provider can send the prescription over to the pharmacy. You know already that it's going to be covered, that you're going to be getting your benefits and your financial assistance taken care of, and then you're right there at the door of the specialty pharmacy in the same visit and able to get your specialty meds.
So is there some benefit for that provider as well? Like maybe in a provider pharmacist relationship type piece? I mean, is it helpful to know who your specialty pharmacist is, or is it kind of something you're used to not knowing and it doesn't really matter that much?
I think that it is very beneficial and impactful. One of the things we make sure we do when we build up and begin a specialty pharmacy is build relationships with the clinic team. So, you know, we have pharmacists that we choose carefully based on their personalities for not only patient care, but also for integration into the clinics. And through those relationships, any issues, you know, maybe we do patient assessments, clinical monitoring, that type of thing. So any issues that arise when monitoring a patient, doing the assessment, or even access to the drugs, again, back to that, are resolved more easily when you have those relationships with the healthcare team.
You also have a one-on-one relationship with your pharmacist. You're going to have a pharmacist with you every step of the way, making sure you know how to administer your medication, making sure you're getting your refill when you're supposed to. You'll get calls once a month to make sure that you're getting your refill filled, that we have access to the medication, that it's there for you. And you have a pharmacist right there that's holding your hand every step of the way and going through that process with you.
So, you know, let's talk about return, and let's talk about it both financially, clinically, patient sat, you know, any way you can think about it. But what kind of return could I expect on, you know, an on-site specialty pharmacy?
Specialty drugs are very expensive, and the return is very high, especially for a 340B covered entity. I think that, you know, our average so far has been about 600% of a normal retail pharmacy on site.
You know, are there any clinical returns that y'all can think of as well?
Yeah, there are a number of returns, and one of the big ones that stands out is being able to partner with manufacturers who are interested in having active patients on their research medication. So, you know, as you know, bringing a drug to market requires a ton of research. And, you know, when we have a specialty pharmacy on site, we're able to partner with those manufacturers as we monitor and assess patient outcomes and provide data back to them that's appropriate for their clinical trials.
So building a pharmacy is building a specialty pharmacy, right? You've got certain things that you need to put in there. You need space, you need refrigerator. Can you walk me through kind of some basic qualifications you need to build one, and then maybe also take me through the steps it takes to get accredited so that you can start, you know, participating in network with some of these medicines?
Yeah, so that's a really good question. It is a big, long process that requires a lot of resources, a lot of effort, a lot of time. That's one of the things we do to help is we take that off your plate so that we can take on that initiative and we can put in our time and our effort to get this pharmacy off the ground. So the process is, you know, it's intricate, but it's simple. We have to have the space. We have to make sure we have access to drugs. We have to make sure that we have employees, pharmacists. We get into those clinics. and really work with the providers and make sure that we have a good relationship with them as we start to build pharmacy or specialty pharmacy. And then we take the steps towards accreditation. So there are pages and pages of accreditation standards, both the URAC and ACHC, that we're going to partner with you right alongside you to make sure that we have the policies in place, the standards in place, the protocols in place to meet those accreditation standards once we raise our hand for accreditation.
How long does it take to obtain accreditation?
It does depend. And, I think that it's important to think about that. Yeah, it does depend. And I think it's important to remember that you can start filling prescriptions on day one. And we work to find those prescriptions that you can fill immediately as we work toward accreditation. And, accreditation can take 6 months to a year, and it depends on the health system that we're working with and, integrating into their resources.
There are steps too that you have to take before that accreditation. You have to have reporting in place, you have to fill prescriptions. So we're filling those prescriptions day one without accreditation. But, like Heather said, it may take 6 months, it may take a year, but you're filling the prescriptions, you're getting in the networks with the PBMs to be able to fill prescriptions. And then as you kind of get the process stood up, get the pharmacy stood up, get the procedures and policies in place, you're able to become accredited.
And that's a big point too, Lauren, because one thing we haven't talked about are all the things that we have to measure and monitor in a specialty pharmacy as we work toward accreditation.
Yeah, tell me about it. What are we measuring and monitoring?
So in a specialty pharmacy, when you become accredited by ACHC and URAC, you have to keep certain metrics for your phone calls. So that means there is a body in the pharmacy every single hour that they're open, answering the phone call within 30 seconds. Sometimes we can't even open or answer our own cell phones within 30 seconds, and we're having to have enough bodies and enough pharmacy personnel in there to answer that phone. And that means that our patients are getting immediate access. They're getting immediate contact with the pharmacy personnel to have their questions answered, to make sure that they're getting the right appropriate care. And I think that just goes to show how URAC and HCHC accreditation really proves that you're a great specialty pharmacy and that you're taking care of your patients in the best way.
Comprehensive, and that is true. And one of the things that we can do to help with that whole process is track and measure and then report back to those bodies the data, so that lift is not on the health system, but we take that off of them. In addition to that, there's the patient monitoring, there's the clinical assessments that have to be tracked and measured.
That's right.
Clinical pharmacists, you want to talk about that one?
Yeah, every patient that is a specialty pharmacy patient is monitored by a clinic pharmacist. So that means initial assessment. You're going in, you're asking them, what medications are you on? What side effects have you had? An initial assessment all the way down to what other medications are you on? And then they're going to be working right hand in hand with the provider to make sure that the regimen is appropriate, that it is up to date, that it is the most accurate regimen for the patient and their disease state. And then also monitoring yearly. You're monitored yearly by a pharmacist where you're continuing to review side effects. Are you having any issues taking your medication? Have you skipped any medications? Has it affected your disease state? Those types of things. But you're getting continuous monitoring by that clinic pharmacist. And all of that is reported back to ACHC and URAC and the accrediting bodies to make sure that that's happening. So not only are we saying that it's happening, but we're also reporting it and bringing it back to the accrediting bodies.
You mentioned patient satisfaction, and that's a big driver, answering the phone, within 30 seconds or less. But, also required are the patient satisfaction surveys. And those are required by an independent third party. And so you are held to a high standard. And we make sure that those standards are met and exceeded. So we are looking at processes. What does it take to make those patients know that we care about their outcomes and that we're ensuring that they have the access to the medication and the appropriate medication by working with the providers closely.
Another thing that's really important in a specialty pharmacy is most, if not all, of the medications that we're dispensing out of the specialty pharmacy are being delivered to your door. So a patient, you get the medication prescribed to you by your clinic physician, and then you're going home and you're waiting for that package. Specialty pharmacy drugs are very expensive. We've alluded to that already, but a lot of them are refrigerated. Some of them must be frozen. Some of them need to stay at room temperature and can't get too hot or too cold. And so something that's really important for a specialty pharmacy to have, and the accrediting bodies require, is shipping and packaging, and having a cold chain vendor that is allowing you to ship and package those medications at the appropriate temperature. So not only do we have, and we can vet vendors to allow a cold chain process that's allowing us to ship those medications to the door at the appropriate temperature, we have processes and policies in place and required testing that we have to do to make sure that what we have works and that the medications get to your door at the appropriate temperature and aren't ruined before they get to you.
A lot of stuff to monitor. Sounds like a lot of stuff to integrate. What's the technological burden? I mean, how are you monitoring this, and how are you integrating back with the hospital system?
Well, I think the short answer is that when we partner with the health system, there's not a lift for them to monitor this data, because we're doing it for them. So we have our own platforms and we pull that data. We create the outlooks, the output from our analytical tools to report back not only to the accrediting bodies, as Lauren's mentioned, but also to the payers, to the PBMs, because when we're trying to get access for a patient to their PBM so that we can bill them for their care, we have to also report to them a lot of metrics. And so all this stuff we're talking about measuring and monitoring, we have to also report to them just to even get in their network. Same thing for manufacturers. We have to report to them as well to get access to their medication. So there's a lot of reporting that goes on, but we take that lift away from the health system.
So one of the things I do like about how we approach the specialty pharmacy that I think is a little bit different is we provide a glide path, if you will. So it starts with optimizing the 340B network, plugging our analytics tool in, getting the most we can and squeezing the balloon of the already existing network, understanding where drugs are going, are they going to appropriate pharmacies, are the appropriate providers in the appropriate place on the cost report. So how do we launch that up, going through and build a retail pharmacy that we can start capitalizing on with meds to beds, with employee prescriptions, with other clinic prescriptions in there, and get that going. I mean, I think that's unique, because we can drive, while this is being built, millions to the health system, and then have that cover the cost of doing it.
They are really excited about the program, generally speaking. They're very supportive of, working with us to take a look at their 340B program so that we can look at anything that we could do to optimize it. And there's, you could work 340B day in, day out, and you can still find ways to optimize it, to make it more compliant, to make sure you're capturing everything coming out of that health system. So they've been wonderful about that. I think they're really excited about the idea that we will grow their 340B savings back to the health system while taking care of their patients, and they'll be reinvesting some of those savings into the specialty pharmacy project, and it's been tons of support for that.
Getting paid more for doing better by their patients. I love
Absolutely.
it. I love it.
One of the main leaders that I've been speaking to and working with, she's really been my go-to, my person that I go to see who in the health system, who in the leadership team at this health system we can talk to get the answers, and really providing the knowledge required to be a leader in the specialty pharmacy. As anybody that's worked in the health system, trusting outside bodies can be difficult. So I've had to build that trust and that communication between myself and this leader to be able to establish something that's going to be successful in the future.
We come from a major academic medical center. What lessons did you learn from that experience that you're applying now to help drive this?
Yeah, so communication is very important. I learned that right out of the gate working in a health system. If you want something done, if you think you want something done, communicating that is the most effective way. There are all different ways and avenues to communicate, but one of the things we've had to deal with, ever since COVID is we're working virtually. So some of the conversations and meetings that are had are virtually, and establishing that trust is even more difficult when you're not in a face-to-face conversation. So one of the main things that I've had to do is just increase my one-on-one time with leaders in the organization to make sure that we're on the same page, to make sure that the questions that need to be asked are being asked, to break down all the walls and the barriers of, what would this person think of me, or can I ask this question, or I'm not sure if I know the answer and I don't want everyone to know that I don't know the answer. That's what we're here for. We're here to make sure that we're building up these leaders, and they've never had a specialty pharmacy before. That's where we come in. We come in to provide those answers, to provide that confidence that they need to not only start and open a specialty pharmacy, but manage it and run it and make it successful in the future.
How does a hospital get upside down on a specialty pharmacy? I mean, like, what causes a negative reimbursement or a low margin?
That's a great question. Actually, one of the easiest ways is not paying attention to the 340B status of a particular dispense. So, especially if you're a disproportionate share hospital, a DISH hospital, you're subject to the GPO prohibition. And as such, you would be hit with purchasing the drug at WAC rather than on a 340B account if it doesn't qualify. So that's another way that we partner, and we make sure that every prescription that should be eligible is deemed eligible in the processor, so that they're not upside down in a pharmacy dispense.
So what do you do if you get sent a drug and you don't have access to that PBM yet? I mean, how do you handle that?
Yeah, you really don't want that to happen, because that means you're going to need to send your patient somewhere else to fill their prescription, which that can happen. But one of the things that we do is we make sure when we go in for the specialty pharmacy project at a health system is understand who the payers are in that area, in that community, so that we can go ahead and address that on the front end and get access to that network. So we work through that, navigate through it, reporting all the requirements, as Lauren mentioned before. We make sure all that's done, and so our goal is to take care of every patient.
So talk to me about getting a prior authorization. I mean, assuming most of these drugs require prior authorization, what type of time is spent doing that? What's the burden on a facility to do that?
Well, and that's the thing about specialty pharmacies, because it's so high cost. Many PBMs will not pay for it just out of the gate. So there are a lot of hurdles you have to get through with the payer to get the drug covered. And then even once it's covered, the copay can be really high. It could be thousands of dollars. So most of the time, patients can't afford a copay that high. And so what we do is we search for copay assistance. There are manufacturer programs, there are other assistance programs.
Yeah, third-party programs
Third-party
out there.
programs, right.
Charities.
Charity care. We search for all of those and make sure that, just within a few days, it's usually, 2-day turnaround and the drug is on its way to the patient.
And that's another benefit of having a pharmacist embedded in the clinic that the patients are in, because that pharmacist in that clinic is able to provide that assistance before they even get to the specialty pharmacy. So they are able to look for financial assistance. They're able to perform those prior authorizations, making sure that it's going to be paid for and that the patient is going to be able to afford it even before the patient gets to the specialty pharmacy, has a conversation with the pharmacist that's dispensing the drug. It's already taken care of. So once it gets to the specialty pharmacy, we're going to be able to fill it because we've done all of that on the front end in the clinic setting.
Great. And I'm assuming from the patient, there's no surprise bill. They understand how this is going to get paid. And the people that are taking these drugs are generally your sickest people, right? I mean, that's what a specialty drug is. It's people with cancer, MS, etc. And we don't want them worried about their bill.
That's correct.
So talk to me about the relationship between retail pharmacy and specialty pharmacy, and what advantages or efficiencies do you gain by having both of them in a system and coordination between the two?
When you have a retail and a specialty pharmacy on site, then you can ensure that the entirety of the patient's prescription care needs are met. So they may have a prescription coming out of the retail pharmacy and out of the specialty pharmacy, and we can ensure that they get both, that there's no delays on either, that each team knows what the other is doing as far as providing for that patient, and even to the point of combining that shipment. If it's a prescription need that we need to mail, then we would be able to bundle that up and get it to the patient all at one time.
So in our pharmacies where we have retail pharmacies and specialty pharmacies. Could I call the retail pharmacy with a question and get an answer, or about a specialty drug, or help coordinate that way, or is it just completely siloed?
Yeah, so yes, you could, because either place you're going to end up with a pharmacist that's going to have the education needed to answer most of the questions. But when it comes down to the really clinical, anything about patient monitoring or anything that has to do with the really high complexity meds, then we would end up getting our clinical pharmacist for that disease state involved, because they have the training, in-depth training and certifications they need to really address the patient's questions.
So why ProxsysRx? Specialty pharmacies are important. They're an important part of our pharmaceutical ecosystem, and we help health systems achieve this. We can create a financial glide path that makes the burden of financing this little or no risk, and we do this well. We take on everything from the beginning to end, so the hospital can rest assured that it's in good hands, and they don't have to spend extra time or energy or effort worrying about whether or not their patients are going to be seen, their sickest patients are going to be seen.
Opening a specialty pharmacy is incredibly challenging, and we take that burden off of the health system. We're the experts that walk them through and navigate them through getting that specialty pharmacy up and running and successful, and meeting the accreditation requirements, getting access to the medications, getting access to the payers, integrating with the clinic teams and everything that's required to really grow the specialty pharmacy on site.
We get to know your doctors, your clinicians, and your patients so that we can tailor your specialty pharmacy to the needs of your patients and the difficult disease states that they need to manage.